everyone for tuning into today's webinar. My name is Dr. Mary Kikolas, and I'm the chiropractic physician at Align Modern Health Elmhurst. We'll be discussing injury assessments for the neck and the back. As I say to all my patients, pain is usually the last one to show up to the party. Often we have various dysfunctions, whether it's loss of range of motion, muscle weakness or tightness, improper muscle firing patterns, or poor mechanics that we ignore until pain shows up. Today, we're going to go over some simple tests that you can perform at home to assess your body and prevent future injuries. We're going to start with assessing the cervical spine or the neck range of motion. While testing range of motion, we want to check if there's pain during the range of motion, if there's pain at the end of the motion, if the motion feels stiff or restricted, or if one side feels different compared to the other. Range of motion can be altered due to many reasons, but one of the most common causes is being posture related. So first, we're going to start with flexion. I want you to bring your chin all the way down to your chest. Again, we're going to bring your chin all the way down to your chest. I want you to note if you have any tightness or any stiffness in the back of the neck. And one more time, we're going to bring that chin all the way down to your chest. Next, we're going to look at extension. I want you to take your head and look all the way up towards the ceiling. Again, we're going to look all the way up to the ceiling, noting if you have any tightness in the front of the neck or any discomfort in the back of the neck. And one last time, we're going to look all the way up to the ceiling. Next, we're going to look at retraction. You're going to pretend like there's a board right underneath your chin, and you're going to take your chin and push straight back. Again, pretending like there's a board underneath your chin, I want you to push that chin straight back, noting if you have any discomfort in the front of the neck or in the back of the neck. One last time, we're going to push that chin straight back. Next, we're going to look at rotation. With rotation, I want you to start on the right side. We're going to rotate our head looking all the way as far as we can over our shoulder. And then we're going to look to the left as far as we can over our shoulder. With rotation, I want you to compare side to side to see if one side feels a little bit more restricted or tight compared to the other. So again, we're going to rotate all the way to the right. And then we're going to rotate all the way to the left. And then one more time as far as we can to the right. And as far as we can to the left. Last range of motion that we're going to look at for the neck is lateral flexion. So we're going to start on the right side, and you're going to take your right ear and bring it as close as you can to your shoulder. And then we're going to do the same thing on the left side, taking your left ear and bringing it as close as you can to your shoulder. Again, we want to compare side to side to see if one side feels different than the other. So again, we're going to compare, bringing that right ear to the right shoulder. And then the left ear to the left shoulder. And last time, we're going to bring that right ear to the right shoulder. And the left ear to the left shoulder. Next, when performing a physical exam, I often perform an upper nerve tension test. This test is used to see if there's any irritation to nerves in our neck and upper extremity. Irritation to nerves can cause different sensation in an individual's neck or arm, including numbness and tingling, pins and needles, dull achy pain, throbbing, sharp or shooting pain. For our upper nerve tension test, we're going to start on the right side. We're going to extend that right arm all the way out as far as we can. We're going to drop those fingertips down to the ground, and then we're going to bend our head away from our arm. Again, we're going to repeat that on the opposite side. You're going to extend that hand all the way out. You're going to drop those fingertips down to the ground, And then you're going to bend your head away from your arm. We're going to perform that again on the right side. What we're doing is all of our nerves start at the base of our neck and they go all the way out to our arm. So we're stretching it out in the arm, dropping those fingertips down, stretching it out at the hand, and then bending our head away from the arm, stretching it out even more at the neck. We're trying to see if we have any tightness or irritation to those nerves in the neck, anything in the arm, or anything down into the hand. And then last time, we're going to perform it on the left side. So you're extending that arm all the way out, dropping those fingertips down to the ground, and bending our head away. Seeing if we have any irritation in the neck, any irritation in the arm, or any irritation into the hand. Next, we're going to check a few muscles in the neck to see if there's any irritation when these muscles are stretched. A lot of times, poor postural habits or poor body mechanics can cause muscles to become tight and overactive when stretched. First, we're going to start stretching out our upper trapezius muscle. We're going to start on the right side, and you're going to relax that right arm to your side. You're going to take your left hand and pull your head to the side, stretching out that muscle. What we want to see is if we have any tightness that goes from the base of the neck all the way out to the shoulder. We're going to do the same thing on the left side, relaxing that arm to the side, taking your right arm, grabbing your head and pulling it to the side, stretching out the left. Seeing if there's any tension again at the base of the neck, all the way out to the shoulder. Again, we're going to perform that on the right side, relaxing that arm to the side, grabbing your head with your left hand and bending over to your shoulder. And then one more time on the left side, relaxing that left arm to the side, using your right arm, grabbing your head, bending over to the other side of your shoulder. Next, we're going to look at the levator scapulae muscle. We're going to start on the right side again. You're going to relax that right arm to the side. You're going to take your left hand, grab the back of your head, and bring your nose down to your armpit. For this muscle, we want to see if we have any irritation from the back of the neck to that shoulder blade region. And we're going to do it on the left side, relaxing that left arm, taking your right hand, grabbing the back of your head, bringing that nose down to your armpit. We're going to perform it one more time on each side. Relaxing that right arm to the side, using your left hand, grabbing the back of your head, bringing that nose down to your armpit. And then on the left side, relaxing that left arm, using your right hand, grabbing the back of your head, bringing that nose down to your armpit. Again, checking to see if we have any irritation from the base of the head down to that shoulder blade region. The last muscle we're going to check is your anterior neck flexors. So you're going to take your hands and put it right on top of your clavicle, which are those bones that stick out in the front of your chest. You're going to extend your head all the way back. And then we're going to start on the right side and bring your right ear to your right shoulder. Seeing how that feels in those muscles on the left. And then for the other side, extending all the way back. Bringing that left ear to your left shoulder, seeing how those muscles feel in the front on the right. One more time, we're going to have those hands right on top of that clavicle. We're going to extend all the way back. Bring that right ear to your right shoulder and seeing how those muscles feel on the left. Extend that hand all the way back. Bring your left ear to your left shoulder and feeling how those muscles feel on the right. The motions we just used to check the tightness in the muscles of the neck can also be used as stretches to relieve neck tension and improve range of motion by holding each position for about 30 seconds on each side. Next, we're going to move into assessing the thoracic spine or the mid-back range of motion. While testing range of motion, again, we want to make sure we check to see if there's any pain during the range of motion, at the end of the motion, any stiffness or restriction, or if one side feels different compared to the other. For our mid-back range of motion, we want to start by rounding out the mid-back. So you are going to bend forward, rounding out as far as you can. And then we're going to do that one again. Bringing those shoulder blades forward, rounding out that mid-back as far as you can, bending on forward. Checking to see if we have any irritation in that back. And then one more time, we're going to round the shoulders forward, bending on forward. Perfect. Next, we're going to look at extension. You're going to cross those hands in front of you. And I'm going to use the back of my chair as a support, but you are going to extend all the way back, looking up towards the ceiling. Again, crossing those hands in front of you. You're going to extend all the way back, seeing how that range of motion feels when you hit as far back as you can. And then one more time, we're going to check that extension, crossing those arms, extending all the way back as far as we can. The last range of motion that we're going to look at for the thoracic spine is rotation. We're going to cross those arms again, and we're going to start by going to the right, and we want to rotate as far to the right as you can. And then we're going to rotate to the left. Again, we're going to rotate to the right, seeing how far we can go with that right side of rotation, and comparing that to rotating to the left side. Last time, we're going to rotate all the way to that right, seeing how all that feels in the back. And then rotating to the left. The motions we just checked can also be used to decrease stiffness after prolonged periods of sitting. Perform about 15 reps of each motion to loosen up muscle stiffness and decrease tension in that upper to mid back. Our thoracic spine or mid-back range of motion is often coupled with our lumbar spine motion. So finally, we're going to assess the lumbar spine or the low back. While testing range of motion, again, we want to check to see if there's pain during the motion, at the end of the motion, any stiffness or restriction, or if one side feels different compared to the other. First, we're going to start with flexion. We're going to bend as far forward as we can, trying to touch our toes. Again, we're going to bend forward as far as we can, seeing how that feels in our low back as we touch our toes. Again, one more time, bending forward as far as we can, and coming on up. Next, what we're going to look at is extension. You're going to place your hands on your low back. Usually I say right where your pockets are. You're going to push your hips forward and extend on back as far as you can. Again, placing those hands on that low back, pushing your hips forward and extending on back, noting how all that feels during that range of motion and at the end of the motion. Last time, we're going to have those hands right on the low back, pushing those hips forward and extending on back. Next, we're going to look at lateral flexion, which is actually a combination of a mid-back or thoracic spine motion and a lumbar spine motion. We're going to place our hands on our sides, and we're going to bend down as far as we can, running our hand down the side of our leg. And then we're going to compare that to the left side. And we're going to do that again, starting on the right, bending down as far as we can, trying to run those fingers as far down our leg as we possibly can. And then trying it on the left side. Comparing how those muscles are feeling, how that's back feeling as if you're moving through each motion. Last time, bending down to the right. And then bending down as far as you can to the left. The final range of motion that we're going to check for the lumbar spine is called a side glide. You're going to give yourself a good base of support, and we want to make sure those shoulders stay nice and aligned and stacked. You're going to take your hand and put it on your right hip, and you're going to Push your hip to the side, trying to make sure those shoulders stay nice and aligned with each other. And then we're going to do that again on the left side, trying to keep those shoulders as straight as possible. We're going to do one more time on each side, pushing those hips to the right, seeing if we have any tightness or pinching in the low back or anything pinching or irritating in the hips. And then same thing, pushing as far down to the side as we can. And make sure you're comparing side to side as you're pushing them through. Similar to the neck, I also perform a nerve tension test for the lumbar spine. This test is used to see if there's any irritation to the nerves in our lumbar spine and into our lower extremity. Again, irritation to nerves can cause different sensations in an individual's low back, in their glutes, in their thighs, or into their leg. So if you don't mind me as I pull this down really quick, I'm going to show you guys mostly what my legs are doing during this motion. So we're going to start sitting up nice and straight. We're going to start with that right leg. You're going to kick the right leg out as far as you can and bring those toes in towards you. Checking to see how that feels in the low back, in the glutes, in the thighs, and into the leg. We're going to do that motion again on the left side, sitting up nice and straight, kicking out that leg as far as you can, bringing those toes in towards you. Checking to see how that feels in the back, in the glutes, in the thighs, or into the leg. Next, what we're going to do is we're going to have you drop your head forward and slouch into the worst posture ever. You're going to kick out that right leg again, bring those toes in towards you. This is where we're truly testing that nerve tension by stretching out those nerves from the neck, the mid back, the low back, now out into the leg. So we're checking to see how everything feels in our glutes, into the leg, into the thigh, and into the calf. Same thing on the left side, staying in that nice flexed position, kicking out the leg as far as we can, bringing that toes in, checking to see how it feels in the back, in the thigh, in the glutes, or into the calf. One more time, we're going to drop that head down, round out into that slouched posture, kicking out the right leg, bringing those toes in, seeing how those nerves feel when they're tightened. Last one. Keeping that head down, slouch out into that terrible posture, kicking out the left leg, bringing those toes on in. Again, we're going to check out a few muscles for the low back to see if there's any irritation when those muscles are stretched. There's a lot of muscles that are attached to the mid back and the low back, but we're going to assess two that we can check easily when seating. You're going to sit up nice and straight. You're going to take your right arm and raise it into the air. You're going to bend over to your left side, and then you're going to rotate on forward. Seeing how that feels in that low back and the sides throughout the low back, trying to see if we can stretch those muscles without any irritation. Again, raising the left arm, bending on over to the right side, and then pulling yourself on forward, seeing how that feels in those muscles. One more time, we're going to have that right arm raised. We're going to bend over to the left side. We're going to round ourselves on forward, stretching out all those muscles in the side and in the low back. And then last time, raising that left arm, bending over to the right side, bringing yourself on forward, stretching out those muscles in the low back and the sides. Again, you can hold these stretches for about 30 seconds on each side to provide some relief when you're sitting for prolonged periods of time. It's also beneficial to schedule some breaks throughout the day just to get up and move. Try to schedule a small break every hour or two just to walk around and stretch in order to decrease muscle tightness and joint stiffness. To end our demonstration, I want to do a quick breathing assessment. Most people are unaware of the fact that we're supposed to be actually expanding through our stomach when taking a breath in instead of raising our shoulders and expanding out our chest. By performing proper belly breathing, We can not only relax those muscles in our neck, which provides decreased tightness and stiffness, but we can also support our low back, especially when bending and lifting. So again, sitting up nice and straight, I want you to place one hand on your chest and one hand on your stomach. The goal is to not have the hand on your chest move and to have your breath in expand completely out on the stomach. So you're going to take a nice deep breath in and all the way out. Nice deep breath in and all the way out. One more breath in and all the way out. It's much easier to assess breathing when you're laying down and to really focus on that full expansion of the belly. But this is something easy to calm you down throughout the day and kind of reassess your breathing habits when you're stuck sitting at the computer all day. I want to thank you all for listening to today's webinar. I am now happy to answer some questions if you type them into the Q&A feature on Zoom. If there's anything that we can't get to in this time allotted, you are more than welcome to schedule a free 15-minute consultation with any of our Align Modern Health clinic locations in person or via telemedicine. I'm going to pull up a slide really quick with our contact information and which insurance providers we are in network with. So the first question I have is if we'll have access to this recording. Everybody's going to be sent out a copy of the recording within the next week. So I have one question that's regarding very specific pain patterns. Your best option would be to set up a free consultation with one of our clinic providers at any of our Align Modern Health locations, and they'll be able to give you a better idea of how to assess the situation, especially during that free 15-minute consult, so they can talk one-on-one with you. So I had a question if our facilities offer chiromassage or massage therapy. We do. When we prescribe massage therapy for our patients, it is very specific oriented, so it's doctor prescribed massage therapy. I usually say it's not your like laid back relaxing massage. What we usually do for our patients is we are during the exam are looking for very specific muscles that are tight and then to have either trigger points or muscle knots that we have to work out with our massage therapist. So we talk very closely one-on-one together and we make sure that we're providing very specific massage therapy care. So I have a question about a good desk chair when working from home. Making sure that you're taking into account your computer position, where your armrests are for your desk chair, the height of the desk chair, and the height of your desk, which I know that's a lot of information. But you want to make sure when you're sitting in your desk chair that your butt is actually higher than your knees so you can maintain proper lumbar spine curvature and posture. You also want to make sure that you're able to look straight ahead at your computer monitor so that you're not looking down or looking up too much, which puts more strain on the neck. And you also want to make sure that your hands are rested in a comfortable position where you don't have your shoulders up when you're typing or you're not kind of dragging everything forward. So I know that's a lot of information and it does take time to tweak around setup, but as long as you have a chair that you can adjust to those different heights or a desk that you can adjust to those heights, it's very, very easy to kind of position everything properly so you can maintain good posture, breathing mechanics, and everything else when you're stuck working all day. And a patient asks what exercises we can do daily to optimize strength in our arms and our hands. Big things that I usually tell people is working on forearm strength and hand strength is very specific motions. So if you are wringing out a towel, it's a good way to work on those tendons and those muscles in our forearm. If you have rubber bands, just putting rubber bands around your fingers and working on extending them out or moving the hands up and down to get grip strength. Also, if you have weights, just bringing those wrists up and down, in and out are great exercises just to gain that strength and work on those wrists and those hands. I have one patient that asks if all chiropractic care for pain requires PT or if you can do just manual adjustments. I do both. So I do have patients that we just do adjustments, but I have a very strong rehab background. And I think it is very important for my patients to not only get their joints moving with adjustments, but also strengthen those weak areas and loosen up those tight areas so that you can function better all around. And so we work on full strength of body mechanics and also getting those joints moving to decrease some of that pain. It is a complete type of care, but it's our best way to get you stronger, get you better faster, and make sure that your issues don't come back. I have another patient or person asking for a pinched nerve and back seizes up towards the end of the day. Another thing that I would probably set up a 15-minute consultation with one of our providers. We want to make sure that we stop conditions before they start getting worse. So we want to make sure we find something that we need you to do specifically to decrease that nerve pain and also get that back to stop seizing up. A lot of the times people are like, yeah, it's not too bad, but as it starts impacting our day more and more, we want to make sure that we stop this completely and not having it become a chronic recurring issue. All right, I want to thank everyone again for tuning in for today's webinar. Again, our contact information is on the screen currently. Feel free to set up a 15-minute consultation, whether in person or with one of our providers in any of our clinics, so that we can help you get better, stronger, and get you feeling pretty good. All right, have a great day, everyone.